Heart attack is the number one cause of death in India as well as across the world. And day to day, its incidence is increasing out of proportion. Especially in India, Indian population will get heart attack even at younger age compared to the Western population. Indian population are getting heart attack 10 years earlier compared to Western population. That is because of our genetic predisposition. That means our body is genetically predisposed to get a heart attack, and then because of rapid and unplanned urbanization leading to unhealthy lifestyle. The risk factors for getting heart attack are: one thing is hereditary, that means it may run in families, and second thing is because of other external factors like lack of physical exercise and unhealthy diet, taking a lot of junk food, and hypertension, that means high blood pressure, diabetes mellitus, that is high blood sugars, and then high cholesterol levels in body, and then tobacco consumption in any form, smoking or chewing or sniffing, any form of tobacco. So it contains nicotine and other toxic materials. They causes blockage of heart blood vessels. And then excess alcohol consumption. Alcohol consumption in excess, that leads to the heart muscle weakness as well as heart attacks and lot of mental stress. This is one of the factor which predisposes us to get a heart attack. And how to prevent heart attacks? If anybody in the family had a heart attack, then next generation may be at risk of getting a heart attack at a younger age. And then these people from age of 30 years, they have to go for periodic checkup with a doctor, and then they have to monitor their blood pressure, cholesterol and sugar levels, and then maybe ECG, 2D echo kind of things as advised by cardiologist, they have to go. And then you have to do regular exercise. At least 30 minutes per day is recommended, and at least 5 days in a week we have to do this thing. And the ideal activities advised are walking and swimming and cycling. Basically, the amount of exercise should be moderate, not too strenuous or not too like just like yoga. And then it has to be sustained for a 30 minutes. Then only it will be effective and beneficial to the heart. And then you have to change your diet. You have to take healthy diet that should be low in salt and then low in fat. Basically, you should try to avoid red meat, and then dairy products like ghee, butter, and cheese, and then soft drink which contains high sugar levels. You have to take more protein like lean meat, fish, and then egg white, and then protein dal. And you have to take high fiber diet like green leafy vegetables and then fruits. And you have to quit smoking or tobacco consumption in any form, and then avoid alcohol consumption in excess, and then check your blood pressure and then sugar and then cholesterol levels at regular intervals. And if you are having any abnormalities in these things, you have to take the regular medications, and then you have to keep those things in control. And if you have any pain, consult a cardiologist, so that you should not neglect that it could be related to cardiac thing, and then it's going to be problematic. So if you want to prevent a heart attack, act now for better tomorrow. Thank you.